this is a very good question. How often do neurosurgeons agree on the measurement based on the same MRI?
Yeah. Well, Dorothy, we looked at that at CSF a little bit, right? But Brandon Rock was studying that, and there is definitely a disagreement. Um, I would say just subjectively, when we're giving second opinions and so on, my measurement and assessment of the MRI is usually very similar to other surgeons that the patient may have seen in the past. So it's quite unusual for me to make a measurement that's like radically different than what another surgeon would do. It does happen sometimes, but it's quite unusual. So I think, yes, there are differences. Like, it's not unusual at all for somebody to measure like a 7 when it's a 9, or a 5 and then it's a 7. Those are just measurement errors that are not very important. Yeah, I think it's quite unusual to see cases where I'm measuring 10 and somebody else thinks it's 0 or 20 or something like that. That just means they did it wrong, basically. But if somebody knows what they're doing, in general, you're going to be accurate within a few millimeters, I think. And you're going to see inter-observer reliability in that range.
Well, I agree with that. And I do know that there was a paper done by Oliver Wieben a few years ago, where he was talking about MRI and the inaccuracy of that, depending on how it's done. So, and when you're talking about measurements, how important is it to go to a good MRI place, or what is a good MRI place to go, and what kind of study should be done?
Yeah, so, as I said, we have a Chiari protocol, which is basically a standard brain MRI, T1, T2, no contrast. We don't give contrast for Chiari. I don't think it's necessary. A lot of patients will get it anyway, but we don't ask for it. I think it's important to see at least the cervical spine. Most of our patients have complete spine imaging, but the cervical spine is what I'm basing most of my decisions on in terms of the decision for or against surgery. And again, the flow studies are usually done for us, but I don't ask for them anymore. Yeah, what's a good MRI? I think it should include the brain and cervical spine. At least it's nice to get more if you can. I like to not just see the posterior fossa. I like to see the whole brain, because you want to make sure that there's not something weird going on, that you're not diagnosing. Like, you want to make sure you're getting the cases of secondary Chiari from, say, CSF leak or from hydrocephalus or a mass lesion and so on. So you need to rule that out. And in order to do that, you really need the full brain MRI. You don't want to just get a posterior fossa study or just make a diagnosis of a Chiari on a cervical spine study. You can do it. You can diagnose Chiari on a cervical spine, but I would never want to bring somebody to the operating room on the basis of just that study alone, because you might be missing a serious comorbidity that you'd only pick up on the brain scan. Same thing with the spine. I want to know if there's a cervical syrinx. And if it's just a brain scan, then you might miss that. So I would always, if I don't have those two components, I think that's critical and essential. I would send the patient back to get a complete study for that. Different MRI places have different qualities, of course. In general, frankly, Chiari is not that difficult to diagnose on an MRI. Like, there are some neurosurgical diseases that if you don't have a really high quality study, you're just going to miss it. Chiari is not like that. I mean, almost any MRI place should be able to diagnose a Chiari if it's there, in my opinion. It's really hard to miss a Chiari if it's anatomically present on any quality of MRI. The open magnets are definitely lower quality than the closed magnets. A lot of people like the open magnets if they have claustrophobia, which is understandable. You will get a lower quality study. It's just a fact. For something like Chiari malformation, which is, again, hard to miss if it's there, it doesn't bother me that much if somebody wants to go on an open magnet. But they should know that they're going to get a lower quality study with the open magnet.